Welcome to today's episode of Health Check with me, Roxana Gishia. Today we have an exciting and informative episode just for you. We are diving into the world of physiotherapy, a field dedicated to helping people recover from injuries, manage pain, and improve your overall physical health and well-being. Whether you're an athlete looking to enhance performance, someone recovering from surgery, or simply interested in maintaining your mobility and preventing injuries, this discussion is for you. Joining us today is Glory Minor from Valley Hospital, a highly respected and experienced physiotherapist who has helped countless individuals achieve their health goals through personalized treatment plans and innovative techniques. Doctor, thank you so much for being here.
Thank you.
How are you doing?
I'm good. How are you?
I'm doing good. And welcome again to this episode.
Thank you for having me.
As we start, please explain to our viewers what is physiotherapy and why is it so important in healthcare?
Right. So thank you. Physiotherapy, simply put,
Yeah.
is a healthcare profession that mainly focuses on helping individuals improve their movement and function through physical techniques that I'm going to touch on as we go by. So in physiotherapy, we do assessment, diagnosis, treatment of various physical conditions that may arise either due to injuries, illnesses, age, or even disability.
Okay.
So the treatment techniques that we use, as I mentioned earlier, we use physical techniques, are one, prescription of therapeutic exercises, such as strengthening exercises, flexibility exercises, balance and proprioception exercises. We also use modalities such as transcutaneous electrical nerve stimulation, which is in short TENS, which normally helps to manage pain and also stimulate muscles.
Okay.
We also have use of ultrasound, therapeutic ultrasound, which helps to manage conditions such as injuries. It helps in tissue healing and also in management of pain as well and inflammation. We also have the use of heat therapy, such as hot packs, and also cold therapy, such as ice packs.
Okay.
We also, apart from modalities and exercises, we also have manual therapeutic techniques, such as soft tissue manipulations and joint mobilizations that also help in management of pain as well and improving the function of the affected area. Lastly, and most importantly, we also educate our clients or patients on ways to, on first of all, the conditions that they have, ways to manage the condition, what physiotherapy is all about and how it will help them recover, what to expect in their recovery journey, and also lastly, how to prevent future reoccurrence of maybe the injuries or whatever conditions that they may have.
Okay.
Yes.
Okay, so you've talked about who is appropriate to get the physiotherapy.
Yes.
And can someone who is not injured have the physiotherapy?
Yes. So in physiotherapy, we don't only deal with the injured people.
Okay.
We cover a wide array of physical conditions, such as stroke. We have osteoarthritis, which is common.
Okay.
We have low back pains. Like there are different conditions that physiotherapy addresses. So we not only just deal with injuries.
Okay.
Yes.
So what's the difference between the active and the passive physiotherapists?
Okay, so in physiotherapy, we mostly use active treatment
Okay.
in whatever I've mentioned, like prescription of exercises. Passive treatment is not very well recommended, so we recommend that active treatment is used in and it actually works, as research shows.
Okay. Have you ever experienced? Has a patient ever come to your office, and then you had to prepare a plan for them? And what condition was the most crazy conditions you've ever experienced, and how did you come up with a plan?
So basically, let me just say, in physiotherapy, treatment is tailor-made.
Okay.
It's not a one-size-fits-all kind of treatment, in that for all patients you recommend one thing. So we tailor-make the treatment based on the specific needs of the patient and where they are at in terms of recovery. So different people, different ages, different recovery processes. So we normally make or set our treatment plan according to the individual. So it's not this particular treatment for everyone.
Oh, have you ever experienced a patient who came to your office and asked for help, and then you went ahead, assessed them, tailored a plan for them, and then they decided, you know what, this is too much for me, I cannot handle this?
Yes, right. Yes, that has happened, and it's normal. Some patients, even after we've tailor-made, we've assessed them, we've tailor-made the treatment for them, and we've helped like simplify those exercises so that we can improve the chances of them doing or following up with them at home. We of course still find some patients will still not follow up with with the treatment program that you have planned out for them, but you still continue to explain to them the benefits of following up with the treatment plan, and also that their recovery journey is not only dependent on me or their healthcare provider. It also depends on the effort that they also put as a patient.
Okay.
Yes.
And how long should one recover? Like once I've started doing the physiotherapy that you've made for me, and let's say today is my first day, yeah? So how long should it take for me to recover?
Right. So I want to start first by saying that physiotherapy is not a one-time, it's not a quick fix kind of thing. You just don't come for one session and you expect that your pain will be alleviated, all your problems will be solved. I want to say that physiotherapy takes time, it takes consistency as well, and it takes effort. Just as I've mentioned, it takes effort for both the healthcare provider, the physical therapist, and also from the patient. So depending on the problem that the individual has, we have different time frames for recovery. But in general, early rehabilitation or early treatment it has positive improvements early in.
What should a patient expect? I'm coming to see you, I know, or I have some issues, or I want to, I have some issues, maybe I'm injured or something, and I'm coming to you. What should I expect? The first day I'm coming to see you, what should I expect?
So as I mentioned earlier, in physiotherapy we do assess. So we receive you, we assess what the problem is, we make a diagnosis of what the problem is, and then we make out a treatment plan for you, and then we explain to you on what the condition you're having, explain to you what physio or how physio will help you to recover, what to expect in your recovery journey, and also ways to prevent further complications or future occurrences of maybe the same injury that you have.
Let's talk benefits. What are some of the benefits of physiotherapy?
Right. So physiotherapy is very beneficial in helping you live quality life. And that is one, through alleviation of pain. We help manage pain in the different conditions that patients might present with that have pain. We also improve function, or rather we improve mobility of areas that may have limited movement as a result of maybe disease or the injuries, and also improve strength and stability of affected areas, and also lastly and importantly also education on the various conditions and how to prevent occurrence of the same conditions. So I tell a patient who wants or is looking forward to start physiotherapy that they're welcome. They should start physiotherapy. One of the misconceptions about physio is that it is painful, and so some patients might fear starting physio because they might think that physio might cause more pain. Well, actually, physio will help them to manage the pain. There might be some discomfort during the treatment, but the main aim of physio is to help alleviate the pain and help them to function better. So they should start as soon as possible. And also it is important to start physiotherapy soon so that we avoid complications that come about when there is delayed management of a particular condition.
Okay, thank you so much for coming. And you guys, as you're watching, please go and look at other videos that we've done. That is at Colib TV. Look at Valley Hospital on all their social media pages. For now, it's just a goodbye. See you next time.